Hi, my name is Shawn. I'm a nurse practitioner student, and I'm here with Cindy, who has agreed to be my student participant for this video. And we are going to check the neurological exam today. We're going to check the 12 cranial nerves to begin with. And initially, when Cindy walked in the room, I watched her gait. She had even arm swing, and she had a steady and smooth gait. And so we'll start out with the cranial nerve 1, which is the olfactory. And so what we'll do is we'll check her sense of smell. I'll have her occlude one nostril and tell me what she smells.
Vanilla.
Okay, and then I'll have her occlude the other nostril and tell me what she smells.
Cinnamon.
Okay, very good. We'll go on to cranial nerve 2, the optic. Before this video started, we had her check her visual acuity with a Snellen chart, and her vision was 20/20. What else we will do to check her visual fields is I will have her cover one eye, the same as the eye that I'm covering. Tell me when you see my fingers come into your field of vision.
Now.
Okay.
Now.
Okay.
Now.
All right, cover the other eye.
Now. Now. Now.
Okay. And then I will also move on to cranial nerves 3, 4, and 6. They all work together, and I will check your pupil reaction. And just look at my light when it's on. Sorry. Look straight ahead. I'm sorry. Okay, that all looks good. Your pupils look equal and reactive to light and accommodation. I'll have you cover your eye, one eye for me. Look at a spot over here on the wall, and then remove the cover. Okay, do the same thing with the other eye. Okay, and remove it. Okay, very good. That all looks good and normal. The next thing we'll check is cranial nerve 5, trigeminal. I will have you clench your teeth for me. Okay, move your jaw side to side. Okay, and then I will use this Q-tip, and you just look straight ahead and tell me if you feel sharp or soft.
Sharp.
Okay.
Soft.
Okay, very good. All right. The next thing we're going to do is we're going to check your cranial nerve 7, which is your facial. And so if you would do some of these movements for me, if you would raise your eyebrows, smile, frown, whistle, puff out your cheeks. Very good. All normal. Cranial nerve 8 is your acoustic. We're going to check your sense of hearing. And I'm going to use the tuning fork. I'm going to strike this, put it on your head. Tell me if you hear this both sides equally.
Yes.
Okay. And then I'm going to strike it, put this on your mastoid, and you tell me when you don't hear it anymore.
Now.
Okay, what about now?
Now.
Okay. So we'll do that on this side as well. Same thing.
Now. Now.
And this will just compare the bone conduction versus the air conduction sound. And then also, I'm going to have you cover one of your ears, and I'm going to say something, and you tell me what, it's called the whisper test, and tell me what I'm saying. Okay, you would just cover this ear.
Puppy dog.
Okay, I'll do this one.
Kitty cat.
Okay, very good. All right, so the next thing that we will do, next thing that we'll do is we're going to check cranial nerves 9, 10, and 12, and these all kind of work together. I'm going to look in your throat, look at your soft and hard palate, look at your uvula for me. Okay, so your uvula is midline, and okay, that all looks really good. And I want to see you swallow. Okay, I'm going to use this stick and check your gag reflex. Okay, very good. If you would stick out your tongue for me. Okay, stick it straight out, then go from side to side and up and down. Okay, that all looks good. If you would, repeat these letters for me. T.
T.
N.
N.
L.
L.
D.
D.
Very good. So that's all normal. The next thing we're going to do, that completes our 12 cranial nerves. Let's move on to the coordination and fine motor skills. We're going to check your upper. If you would, put your hands down on your lap for me and kind of pat your legs. Then turn your hands over and then back and forth as fast as you can. Okay, that's all good. And then I'll have you take your heel and go to your opposite leg and run that down your shin for me. Okay, do the other one. Okay, and that's all normal, and that's great. Okay, and if you would, stand over here for me, and I'm going to check your balance. we're gonna check the Romberg, and how we'll do that is have your feet together, arms at your side, hold your head up, close your eyes, and I'm just gonna watch your stance, make sure that you're not, overly swaying. You got a little bit, but that's okay. Okay, you can open your eyes. That's a normal response. If you would, I want to watch you walk again, watch your gait, and if you would walk, I'd already seen you walk normally, but now I want to watch you, if you would walk on your tiptoes for me across the room. Okay, and when you walk back the other way, if you would, just do heel to toe in tandem. Okay, and that's all normal, even, smooth, and so that's all good. Okay, and even stride, so there, and you can do the heel as well, so that's all good. Okay, I think you've done a good job with that. If you would, you can come back up here and sit down. These tests we're going to do now, your eyes will be closed. I'm going to check your primary sensory response. I'm going to take the Q-tip again, and I'm going to touch you and tell me if this is sharp or soft.
Soft.
Okay.
Sharp.
Okay, very good. Keep your eyes closed for me. I'm going to take this tuning fork and strike it. I'm going to touch you with it. Tell me when you feel it, and when you feel it stop.
Now. Now.
Okay. Do you feel it? Okay. And then tell me when you feel it stop.
Now.
Okay, very good. That's normal. Okay, continue with your eyes closed if you would. We are going to hold your fingers out for me, and tell me what I'm doing with one of your fingers.
Pushing it up.
Okay, what about this one?
Pressing it down.
Okay, very good. Continue with your eyes closed. I'm going to put an object in your hand. This is called, see if you have the ability to identify a familiar object. Tell me what you think that is.
A key.
Okay, very good. Keep your eyes closed. And tell me what you think. This is?
A paper clip.
Okay, very good. The next thing is I'm going to draw something on the inside of your palm. Tell me what you think this is.
A C.
Okay, very good. And what about this?
A 3.
Very good. Okay, the next thing we're going to do is we're going to, I'm going to touch your body somewhere, and I want you to keep your eyes closed, and I want you to touch that area that I touched. Okay, show me where I touched you. Okay, very good. Okay, close your eyes. Show me where I touched you.
Right there.
Very good. I'm going to do a 2-point discrimination. This means I'm going to touch you and you tell me if there's 1 point or 2 points. So close your eyes for me.
2.
Okay, and what about over here? Wait, let me touch you somewhere else, sorry.
1.
Very good. Okay, so the next thing that we'll do is we're going to check your reflexes. I'll have you lie back, and if you would, lie back on the table. Alright, we're going to check your abdominal. We're going to go from the umbilicus outward, and we're going to stroke and watch for your abdominal response, and that was all normal. Okay, then I'll have you sit up for me, once again, sorry, and I'm going to check your reflexes. I'm going to start with your arm, and we're going to check your reflexes on your arm. There's 3, so we're going to check this one, and then I'm going to check down here. Are you relaxed? Okay, and then I'm going to have you relax here again. This is your tricep one, okay, and all those were 2+, which is a normal response. And then I'll also check your knee reflex, knee jerk reflex, okay, and that's normal. And then in these reflexes, if we see any kind of hyper response, what we'll do is check your ankle clonus. And if you would lie back, and I'll demonstrate how we do that. And how we do that is we'll bend your knee a little bit here, and we'll press back pretty much on your, do the dorsiflex on your foot, and we'll look for any kind of jerkiness or any kind of rigid response. And so that's all normal though, that's good. And if you would like to sit up, and that will conclude our neurological examination. Thank you.